is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we are very happy to welcome back to the program Annette Whittemore. She is the founder and president of the Whittemore Peterson Institute, and Dr. Judy Mikovits, Whittemore Peterson Institute scientist and researcher. Welcome to both of you.
Thank you. Thank you for having us.
Oh, it's always a pleasure. There is a lot going on that has occurred since the last time we spoke. Would you like to dive in and start telling us some of the good things that are happening?
Well, there's just been so much. I guess I would start first with the building. It's actually under construction, and it is on the campus of the University of Nevada Medical School, fully funded and ahead of schedule. So we're very excited about that.
And in the bill that just got passed by the Congress, there is funding in there for the Institute, I understand.
There is some additional funding, and we plan on using that for the FF&E rather than going to the state and asking them for the additional money. I'm sorry, the fixtures in the building itself, and so we would need all of that built in. That didn't go into the construction budget.
Another thing that happened on the congressional level I wanted to ask you about, well, not on congressional, presidential level, was President Obama talking about stem cell research and reversing all the things that had occurred under the Bush administration. Does that bode well for you and your research?
Well, we're very, very excited about additional funding. Judy could speak to this a little bit more, but we're told because of this extra funding, the levels of funding we are now going to be getting in our grant funded, which beforehand with limited funds, there was a 10% cutoff. It's now at 25%. So we're extremely excited over that good news.
You know, we should explain to those that may not be as familiar with this, exactly what is chronic fatigue and the surrounding illnesses.
Chronic fatigue syndrome is a syndrome of symptoms, and that some of the problems and immune defects in your immune system's response to viruses and pathogens. So you won't respond the same as a healthy person. New research, we've discovered some of the underlying causes, the genetics that are involved with why some family members get the disease and others don't. So.
And then what would they be? Because this is groundbreaking research.
Absolutely, and they're in what is called the natural killer cell. So this is your frontline defense against viruses, and we've known for more than 20 years that they simply don't kill. So they're supposed to kill, and they're there, and they don't kill, and we found that they're actually genetic susceptibility markers that are not there, or that tell the cells not to kill in a large proportion of the patients that we're looking at with the National Cancer Institute.
Okay, now does this mean that this is something handed down from parents and grandparents, or is this something that may be caused by the environment?
Both, actually, because the particular genes we're looking at are handed down from parents and grandparents, but they're also changed by the environment, by viruses. Viruses and pathogens are very smart, and they can tell, they want to avoid the immune response because that's its job. So they literally are modulated or changed by the virus so that they can't respond. And we've made some discoveries as to what viruses are there changing these receptors. So even if you don't inherit it genetically, you're showing it by your response.
Now, in the coming month here, we're going to have the winner of the DRI Gold Medal, and he's one of the people responsible for mapping the human genome. How is the human genome situation affect the markers, et cetera, that you have, and what benefits could it have?
Well, we've actually done that exact same mapping with 60 patients in the area here in Reno, in the surrounding area. So in Nevada, we've done that exact same mapping, and we're currently finding out all the exciting answers from that research. So
For example?
We've found several response genes in your immune response genes that are altered, or that have a single base pair change that makes them non-functional. I can't say which genes prior to publications, but they're genes that we might expect because they tell the immune response to turn on or off.
And are we at the point where you can actually reverse that?
Yes, absolutely. There are immune modulating agents and therapeutics on the market right now, largely that we use in cancer therapy, that can actually be translated, and that's the goal of our institute, to translate things into treatments right now.
You know, from when we first started talking about this, it seems like there is a snowball effect of where discoveries are being made on a month-to-month basis, not on a 10-year basis.
Absolutely. And I think a lot of that credit goes to the whole design of this research program that Judy put together, which is so comprehensive. So we said we needed to look at the entire picture at one time and bring in collaborators that could take a piece of this and use their expertise, but bring it all to one central location here in Nevada for analysis. And then I think you can translate it much more quickly to treatment.
Okay, let's take a break. Much more on this fascinating topic. We'll be right back to Nevada Newsmakers after this timeout.
To contact Nevada Newsmakers, call 775-857-2244 or go to nevadanewsmakers.com. This segment is sponsored by the law firm of Lewis & Roca, providing local and regional clients in-depth legal resources in today's challenging business climate. And now, back to Nevada Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we continue our conversation about chronic fatigue, but so much more, with the founder and president of the Whittemore Peterson Institute, Annette Whittemore, and WPI scientist researcher, Dr. Judy Mikovits. You said something going into the break there, and I wanted you to elaborate a little bit more on that, on the cooperation between the different specialties now.
Yes, we've established literally a world-class research team here in Reno and around the world with investigators, with expertise at the National Cancer Institute's Inflammation Program, in England with Dr. Jonathan Kerr, around the world, individual specialties in genetics, in virology, in immunology that are attacking the problem from every aspect in this single patient population. So we send parts to one group, parts to the other group, all at the same time, so we get a snapshot of the entire patient's immune response and genetics.
And the cost?
The cost is free. I mean, it's essentially the National Cancer Institute and collaborators are actually doing this with their budget. The Institute has supported it with donations, private donations from Reno residents and Nevada residents who have sponsored the research of these various doctors and scientists at the National Cancer Institute. So we they get matching funds from the National Cancer Institute. The investigators are paid their government salaries, and the money that we use is multiplied essentially fivefold to get these studies done.
You're busting.
However, yes, I do have to, with one caveat. It's we have $1 million budget a year. So between our fundraising efforts, the I Hope You Dance event, our family foundation, and the state support that we receive through the university, it's about $1 million a year to run this program. We're getting a huge amount of help from collaborators outside of the Institute, but it still is very, very expensive work.
Well, and the thing is that if you weren't doing this, no one else was.
That's correct. That was the biggest reason that we started this in the first place, is there is no other translational comprehensive program like this. So while there are other organizations like the IACFS that is coming to town, of organization of professionals who are basically disseminating information to other doctors and other people in the field, and the CFIDS Association, that is an advocacy organization, there is no other single institute like this in the world. So we're very proud.
One of the things that has changed dramatically, from my experience, is that when you talk to a doctor these days, they don't look at you and go, chronic fatigue, oh, it's just in your mind. I mean, because that's what it was talked about for a long time.
Absolutely. I think the legitimacy, the validity, all comes from this type of research. Doctors are scientists, and you know, we all want to be proven. We want to know the answers from scientific basis, and that is what we're trying to provide. The diagnostic markers, so that a doctor will have a blood test, for instance, that will tell him this subgroup of patient, this patient has a particular problem, and this is how we can go about fixing that problem.
One of the ways to put big money into any kind of research is if there's potential for a pharmaceutical company to make money on a drug. How is that branch of things going?
Well, I'll let Judy answer that a little bit, because she comes from the world of drug development, actually.
Yes, and we've established industry collaborations with drug development companies right now that is in the works for developing drugs, and we're starting at the beginning in developing drugs particularly for the deficiencies in the areas that we see for the pathogens, for the immune response, to actually modulate and have it functioning. One of those drugs is in clinical trials currently in Canada, and so we hope to establish a clinical trial here in Reno within the next year.
And will your daughter Andrea be a part of that?
Well, it just depends on whether she fits the criteria, but yes, we're very hopeful that we'll find a medication in one of these drug trials. But also, I think one of the things that we haven't discussed is that there are so many medications out there already in other areas that are treating other diseases, and as we find the markers in this disease, we believe we'll be able to find existing therapies out there and just apply them in a different way to this population.
Okay, we're starting to run out of time, so I wanted to mention the Seafood Association of America, and they've got a photo exhibit starting at Meadowood Mall, and then you're also sponsoring a part of this conference in Reno this week. Would you briefly tell us a little bit about this?
Absolutely. So the IACFS brought the conference to Reno to honor the Institute and to bring more awareness to the disease. So we're very excited to be a part of it. We're actually sponsoring keynote speaker Dr. Kitzhaber, who used to be the governor. He's a former governor of the state of Oregon. He's a physician and very, very involved in healthcare reform. So we're hoping that in his speech he'll begin to talk to us a little bit about how this healthcare system is going to be able to handle chronic disease. We're not really doing it very well right now, and as you know, that the President of the United States is saying we need an overhaul, and I think Dr. Kitzhaber is going to be able to shed some insight.
Okay, and that's wonderful. And I just want to ask a question. We haven't talked about this before, but the Cleveland group that's hooking up with the Ruvo Institute for Alzheimer's in Southern Nevada, is that in any way going to be able to be beneficial to you?
Well, we certainly hope so. We're open to collaborations, and we are actually collaborating right now with another researcher at the Cleveland Clinic. So interestingly, they seem to be playing a big role, and we hope an even bigger role in the future.
It's always great to have you on here, and it's just wonderful to keep hearing good news and great discoveries here as we go along. Small steps, but they're moving much quicker these days.
Absolutely.
Thank you so much for being here. We'll be right back on Nevada Newsmakers after this time out.